Hi everyone, welcome to today's video, Nursing Careers in the Community. Lots of student nurses have asked for this topic today, and I'm going to be talking to Emily Ashwell, who's a community case manager who's just completed a course in district nursing. And Emily's kindly offered to talk about the different roles in the community setting, the difference between a community nurse and a district nurse, how she got funding for the district nursing course that she's recently completed, tips for applying for district nursing, and also a range of other roles in the community setting. So this video is going to be helpful for anyone looking at careers in nursing in the community. So welcome, Emily.
Good afternoon. Thank you for having me.
Thank you for offering
right.
to do the session today.
So shall I start with what my current role is?
Yeah, so what I'll do, I'll just ask you a few questions if that's okay, and then you can sort of it should cover all those areas. So my first question, Emily, relates to your current role. So what is a community case manager? Because I wasn't quite sure when we met prior to this. And what do you do in that role?
Okay, so a community case manager nurse is responsible for a caseload of housebound patients, which involves working with individuals to assess their needs and develop care plans to provide nursing care such as complex medication administration, wound care, palliative care, catheter care, intravenous care, as well as ensuring that their holistic needs are met to allow them to remain in their own homes, maintain their independence, or facilitate hospital discharge. To do this, community case manager nurses also have to have leadership and management skills, so allocating appropriate skilled staff to scheduled and then urgent unplanned visits that might come up on the day.
Brilliant. And one question so that's a really good overview of that role. So thank you, Emily. So one question that students often ask is, what is the difference between a community nurse and a district nurse, as they're different roles, aren't they?
Yeah, so a community nurse refers to a registered nurse who works in the community setting, whereas a district nurse is a senior nurse who has completed further specialist practice qualifications, so either a master's or a postgraduate diploma, which is an additional recordable qualification on the NMC register. So I've recently completed the course, but I'm awaiting the amendment to the NMC register before I refer to myself as a district nurse.
Oh, well done. How long did the course take you?
So it varies between unis. Mine was a year long,
Yeah.
full time, whereas you can also, much more unis are choosing to go for part time, so it's over 2 years, so they can include more things like the V300 prescribing rather than the V100 or 150. So it just depends on the uni.
And when you did it, because you're doing it full time as a year course, are
Mhm.
you being paid in your current role to do that, or did you have to stop sort of working for a year and not have any pay? Just because I know it's probably not what you're expecting me to ask you today, but I think it's important because a lot of students want to look at district nursing.
No, it's really important. Again, it
Yeah.
varies on your trust. You will always be paid. Some trusts it will be as whatever band you are when you enter the course. Sometimes some of them will ask you to drop back down to a 5 for a year. Like it also depends on the area when you qualify, if you're automatically whatever band, or if you have to apply for a job again. So it varies a lot between trusts. So yeah.
That's like so much in nursing as well, isn't
Yeah.
it? Even the sort of the names of roles do, but with district nursing, like you say, it's registered with the NMC, and there are other sort of community roles that are registered with the NMC, aren't there as well? So um, another key question that students wanted me to ask you is, and you've probably been asked this before, I'm sure, do I need hospital experience before I go into the community? So what would you say to that?
I would say that you don't have to have worked in a hospital before coming into the community, because we'll work with you to support you so you feel that you're supported enough to develop and thrive in your new role. So we'll provide appropriate education, initial supernumerary status, and joint visits as required for however throughout your career for anything that you're less confident with or you haven't done in a while, to make sure you feel confident enough with these new clinical skills. However, I personally did 6 months working in a hospital because I qualified early during COVID. So I worked as a pre-registration nurse at the beginning of the COVID pandemic. So I wanted to feel like I was more immediately supported and had people immediately around me before moving into the community once I completed my training. So it's really up to you as an individual, but also if you come out, we're always a phone call away if you're not with us.
Yeah. And you registered and were a student at a really difficult time, weren't you, during COVID, and that's why that worked for you, didn't it? But what you're saying is it's being flexible and it's up to individuals, really, isn't it? So there's nothing stopping anyone going into the community from registration.
No,
And
if you're
that old
interested,
idea.
yeah, you don't have to do ward experience first because the skills are so different. We're going to reteach you everything again anyway. So yeah, just come out.
Yeah, and that's really reassuring, actually, Emily, because I think a lot of students have this perception that going into the hospitals, they're going to learn a lot more skills, the grounding, the fundamental skills of a registered nurse. But actually, what you're saying is you're going to get all of that similar training and support in the community if you start from registration as well.
Yeah, exactly. Yeah.
So you were very very inspiring, Emily. You're going to be really inspiring to a lot of the viewers on my YouTube channel. And I think it'd be helpful for you to talk through your professional experiences and your academic courses from sort of registration, really. I mean, you've already started to talk about the fact that you did 6 months as a newly registered nurse, but if you could talk those through, and the academic courses that have helped your career development to get where you are currently.
Sure. So once I became a fully qualified registered nurse, I then went into the community as a community staff nurse. So here I completed my preceptorship and developed my clinical skills in practice. But I also wanted to build on my leadership and management. So as soon as I came into the community, that's when I found out about the district nursing course. So as soon as I found out about it, I was like constantly building towards that as my goal. So to help build my clinical management skills and quality improvement awareness, I completed the Edward Jenner Leadership Programme independently, so anyone can sign up for that online. I also completed the Florence Nightingale Foundation Early Career Nurses and Midwives Leadership Programme. I also had a very supportive manager who encouraged me to write a journal article, which then leads to more journal articles, more publications. So most recently, like learning resources and even a book chapter in last year. So my enthusiasm for teaching and expanding awareness and nursing in the community also has led me to being a practice assessor, running teaching sessions, and contributing to the development of a course to support students with the transition to newly qualified professionals, which is a challenging step. Like no one can like fully prepare you for that, but we'll do our best to support you with it. I then moved to another trust to develop my career further as the community case manager nurse before completing my district nurse training with them. And soon, it's very exciting, I'm going to be doing a secondment as an advanced community practitioner.
Oh, wow.
Yeah.
Oh, that's so exciting for you.
Yeah.
I mean, it's really helpful to hear your journey. And I think one thing that comes across is you're really motivated. And what you've done is taken those opportunities, but you've created opportunities as well by doing your leadership courses, which I'll ask you a little bit about in a minute. One thing I've noticed with what you were sort of talking about and just thinking about as you were talking is what you essentially have looked at developing is those 4 pillars of nursing and of advanced practice, essentially from Kin Manley, and the new nursing definition from the Royal College of Nursing, as well as looking at those 4 pillars. And I think I've got a video on early career nurses developing those 4 pillars, because they're interrelated as well. You know, you've looked at leadership, you've looked at developing your clinical expertise in practice, education is a theme, research, evidence base, you know, you're publishing as well, which is fantastic. And we did think we might do something on publishing, because you've published different sorts in different journals, and had a different focus for your publishing to mine, maybe that we might do something on publishing in the future. Which is really good. But I think that's the thing. Would you say that they sort of encapsulate those 4, or integrate those 4 pillars of nursing?
Absolutely. That's also what nursing is. We're moving forward towards that evidence base and increasing the clinical skills that they have, because all the different uni courses are changing. So like the nursing one is including more stuff like blood taking and stuff like that. So everything's changing. The district nursing course standards have just changed. So everything's new, and it's working to stay up to date and all those things.
The nursing's always evolving, isn't it?
Yeah.
So 2 things. First thing I want to start with is the Florence Nightingale Leadership Scholarship you talked about. You talked about the Edward Jenner programme, and I think you're absolutely right. It's free, and you can, you know, if you're motivated, you could do that, and it's a great start to leadership. But do you want to talk a little bit about Florence Nightingale Leadership Scholarship, how you found out about it, and how it's sort of helped your career development, and what you learned?
Yeah, so it was first advertised on my trust's preceptorship forum. So I saw it there, thought it was really interesting, and I'd apply for it. So I found that they offer loads of different courses, so you can have a look at their website. This was a fantastic opportunity, as it helped me to develop my confidence, especially my leadership skills, promoting quality improvement projects, but also the networking opportunity with like-minded nurses and midwives across the country. Some of the opportunities, some of the talks I've had from inspirational nurses. Then on my district nursing course, I had the opportunity to spend the day with some of these nurses who I'd met through this course. So yeah, it's been amazing, really.
Brilliant. And it's really interesting that when you're looking at education post-registration, it usually does help your development, because, like, for example, you're saying you did a quality improvement project, and that will inform personal statements and in interviews, won't it? In the future, you can put that down as an area of excellence. And if you're asked about how do you improve quality, you've got an actual example. The other thing with the Florence Nightingale Leadership Scholarship is the networking that you sort of mentioned, and learning from others. So you have that exchange of information and learning from others. And it's interesting that you said it improved your confidence as well. And I think that's something that's really important, that the education and experience improves your confidence. Because what would you say to students out there that are just about to register? Like, how did you feel when you first started to? I know you probably weren't expecting me to ask you this, but I think it's important, because you know, you've talked about it improving your confidence. So you went through the pandemic as a student. Did you feel underconfident when you first registered?
So I think for me, I've constantly, from day one of student nurse to now, I've just constantly gradually growing my confidence, which is one of the most important things, because it's trusting in your ability and the knowledge that you have, recognizing when you might not know everything, but if you recognize that, you can then seek appropriate support. So yeah, always be confident in yourself. You know what you're doing. You've done years and years of university education, so you're a qualified and competent individual, and always ask for help. There's no shame in that.
Yeah, brilliant advice there. So I'm just going to ask you, when we talked about your development, about the district nursing course I've just written down, did you get any funding for the district nursing? It sounds like you were supported, but did you get any funding for the district nursing course?
So the course itself, you can't fund. You need to be supported through your trust, as it's 50% placement and 50% university based. So my course was funded through Health Education in England, which has since merged with the NHS to become NHS England Workforce Training Education. So as part of the application process, I had to complete group interview. In one day, I had a group interview and I had an individual interview with representatives from both my trust and the local university. So it was just one day. My advice for this process would be to make sure you're up to date on current news and policy that's impacting the profession leading up to this. And also to take every opportunity before then, get involved in everything you have the opportunity to, because this will further your career and just leads to more and more opportunities the more that you do, and is great to talk about in the interviews.
Yeah. So the opportunities, would you say, would be the Edward Jenner course, Florence Nightingale doing a QA leadership scholarship, doing QA projects, and stuff like that? Yeah.
Quality improvement in your own team, think about what you could be doing better. Teaching, you don't have to do a course, you can just run teaching sessions for students. I think that was really great. And I started that following my preceptorship. So I had my teaching session, I talked to them about it at the end. So I finished my preceptorship and then went on and did some what my experience was. So I did wound care.
Brilliant. Some great advice there then. So my next question, and this is something I'm asked about a lot, can we talk about the range of career? Because obviously I'm a hospital-based nurse and I've got some understanding of the different careers. And if you go on the NMC website, you'll see different roles that were registered that are like community-based roles registered with the Nursing and Midwifery Council. But there's a range of careers in the community setting, not just community nurse and district nursing. So could you talk about some of the other roles?
Yeah, the community is an exciting place to be at the moment, with the NHS long-term plan as increasing focus on community services to avoid hospital admissions. So there are many new roles even emerging and services developing. So I don't know about all of them, but for example, there's like virtual ward services providing traditionally hospital-based care for patients within their own homes. Urgent care responders providing interventions to prevent hospital admissions, as well as school nurses and health visitors who are also specialist community practitioners like district nurses, and work in a more preventative role to safeguard and provide children with the best start in life. So the specialist practice qualifications, I've done some of the modules at uni with them. There's some overlap with like leadership and management and mental health. So yeah, so many different careers and opportunities out there.
Brilliant. So when you're saying you're doing your courses, that's with school nurses and health visitors. There's the overlap where some of the modules like health promotion or I don't know what modules you're doing, but what sort of modules would you have the overlap with?
So for mine, it was mental health across the lifespan and leadership and management, although again, with the standards changing, all the modules are changing, but there'll still be some overlap again with like policy and like leading quality improvement. We also did our research project together. So it's the same principles of research, but then you go down whatever question suits your role.
Brilliant. So, and another area, I suppose, is the where I look is the Queen's Nursing Institute website has got some fantastic resources, hasn't it? Would you say for sort of community nursing,
and the King's Fund as well,
and the King's Fund. So so those two websites are very good as well. So just two more questions. So what are your future aspirations, Emily?
That's a good question. I haven't got one set path in mind, but I'm interested in quality improvement, influencing and implementing changes. So further management roles, but then also I'm interested in education and developing the future workforce. So I'll just see where my experiences take me, give everything a try and see what I like the most.
Brilliant. And then just one last question. Any other tips for students or newly registered nurses aspiring to the community?
Reach out to your local teams, I would say. If you're a student, I know in my final year I requested a community rotation. So working in a community-based hospice, and then the plan was to go into the community for my final management placement, but obviously COVID, so I became a ward-based pre-reg nurse. But see what your university offers, anything like that. Reach out to your local team, like I said earlier. Just give it a go and see if you like it, because most people haven't considered it. And when they try it and see how autonomous it is, they just love it. So give it a go.
Brilliant. Okay, well, thank you so much for your time today. And I know that the listeners or viewers will find all of your advice really helpful. So thank you very much.
Okay, no worries. Thanks for having me.